A government task force has uncovered what it believes is a coordinated transplant scheme involving illegal organ donations, inflated medical fees, and foreign donors with unverifiable identities, all linked to Mediheal Group of Hospitals and its founder, former MP Dr. Swarup Mishra. The report, now before the Ministry of Health, recommends criminal prosecution, a ban on the hospital's transplant services, and a full investigation into the medical regulator's role in enabling the violations. NTV has access to the findings, and tonight, David Mudhoka lays bare the names, the numbers, and the serious accusations now facing Kenya's health system.
For years, Mediheal Group of Hospitals was one of the most active kidney transplant centers in Kenya, performing nearly 1 in every 3 transplants nationally. But now, a government-appointed task force says the group may have also been the epicenter of systematic transplant violations involving foreign doctors, questionable donors, and procedures that may have broken the law. At the center of it all is Mediheal's founder, Dr. Swarup Mishra, a former member of parliament for cases. Alongside him, the report names 3 Indian specialists, Dr. A.S. Mathi, Dr. Sananda Bag, and Dr. Vijay Kumar. The task force now wants the DCI to investigate all 4 for criminal culpability, including possible violations of the Health Act, the Human Tissue Act, and the Counter-Trafficking in Persons Act. Also, according to the Independent Investigative Committee on Tissue and Organ Transplant Services report, between January 2020 and March 2025, Mediheal carried out 468 kidney transplants, but nearly a quarter of those involved donors who were likely paid for the kidneys, something the Kenyan law expressly prohibits. Then there is the money. According to the report, Mediheal charged patients based on their nationality. Kenyans paid 2 million shillings per transplant. Other Africans, $25,000 or about 3.2 million Kenya shillings. Non-African patients up to $34,000, equivalent to 4.4 million shillings. The task force also found that at least 84 transplants at Mediheal involved foreign patients with unverifiable donor identities. In many of these cases, the recipient was Israeli, while the donor was Azerbaijani, and in more than one instance, the two shared a surname. In 111 cases, there was no documentation on the nationality of the donor at all, raising alarms over possible trafficking networks operating through the hospital. What makes these cases harder to trace is that Mediheal sent all tissue typing and matching samples to a private lab in India, one that is not licensed to operate in Kenya. And it wasn't just the documentation. Inside the operating theaters, the report said unqualified personnel were deployed to perform critical roles. Surgical nurse aides without full training were used in place of qualified nurses. In some instances, recruitment happened via Facebook or WhatsApp with no interviews, credential checks, or formal employment processes. Kenya's top medical regulator, the Kenya Medical Practitioners and Dentists Council, KMPDC, is also in the spotlight. The task force accuses the council of registering foreign doctors without verifying qualifications, failing to respond to complaints, and allowing non-licensed individuals to participate in surgeries. David Mudhoka, NTV, Nairobi.